families would ask if the autism was misdiagnosed, and they would ask for like a second opinion, essentially. In order to have a really solid diagnosis, you really should do what's called direct testing, where you're directly measuring autism-like symptomatology in the individual. So some parents are concerned about a misdiagnosis. The best way to avoid a misdiagnosis is to ensure that you had a really comprehensive evaluation. So an evaluation should always be done or supervised by a licensed psychologist. It should always include parent interview, direct testing measures with the child or the individual being assessed for autism. The gold standard for assessing autism is the ADOS, the Autism Diagnostic Observation Schedule, and there's modules toddler and then 1, 2, 3, 4, and as the kid has more verbal language and they age, the modules go up in sequence. And you also want to make sure that direct time is spent with the individual face-to-face, just kind of qualitatively spending time with them, as well as what's called indirect measures, which are rating scales that are done by parents, teachers, other caregivers that are close to the individual, and in some cases, self-report when they're old enough to talk about what's going on. It's also valuable to get a comprehensive evaluation that kind of rules out common comorbid diagnoses such as social anxiety, ADHD. You want to make sure that it's not something that could mimic autism, and make sure that the testing supports not only a diagnosis of autism, but also rules out things that could mimic autism. So if I was going to do a second opinion and the ADOS was not administered, and the parents they went with autism, and I would reassess it. I would do the ADOS, and if the ADOS came up negative and there weren't a lot of other features of autism in the history, and something else maybe better explained the current concerns that the parents were presenting with, then I would potentially say I believe that the diagnosis was misdiagnosed, and I believe it's this presentation.